Hello, and welcome to another edition of the One Hood Power Hour. Do not adjust your screens. We are looking a little bit different today because it's just me at the helm. We have a lot of great things going on with the One Hood Power team. And so I am going to be holding us down tonight. We have a wonderful program with you all this evening to talk about the upcoming World AIDS Day, which is going to be December 1st. It is held December 1st every single year. And it's a moment that we take time to reflect on what has happened over the past few decades since the AIDS health situation actually began. We reflect on the mistakes that the medical community and the political community made. We celebrate the medical advancements that we have made in reducing the deadly impact of the AIDS and HIV. And we remember those that we lost. So we also celebrate those who are still here, who are living and thriving while living with HIV. And we also encourage people to get tested and know their status. And so there are a lot of events happening around the city. We're going to be talking with two organizations, Project Silk, as well as Allies for Health and Wellbeing, about some of the work they have been doing in southwestern Pennsylvania, but around the region, really, to help people live long, healthy lives, to fight back some of the stigmas that have happened, and to also fight back against some of the discrimination through services and community building and community organizing. So that's a great show that we have for you all. But before we get to our guests, we're going to do what we usually do, just a rundown of some of the news stories and some of the happenings that have been going on. We do understand that this is, I believe, rolling into the second night of Hanukkah. And so that does mean that we want to give our support and love and solidarity and wish all those who are observing a happy Hanukkah. Very interesting to note that because our vice president and her husband practice Judaism, this is the first time that Hanukkah is being observed within the White House, not as a formality, but as part of an ongoing cultural practice. And so I want to talk about how important it is that people do see themselves reflected in leadership and places of power in these administrations that are going on. That's why we do encourage civic engagement so that people can see themselves reflected in the leadership of this country and know that there is a place for them. But last week, we talked a little bit about what was going on in the Pittsburgh public school system. And we wanted to follow up and say we're very happy that as of right now, the Pittsburgh public school system is not going to reinstate a suspension for nonviolent offenses. Again, last week, there was public comment and a hearing to figure out whether or not the the school board was going to vote to reinstate a policy that would see students, particularly what we've seen through the numbers of Black and Brown youth, be suspended for nonviolent offenses. Again, right now, a lot of school districts are grappling with how they're engaging all of these students coming back into the school building all at once and dealing with some of the frustrations, the fighting, the disagreements that have been going on since school reopened. And one of the things they were talking about is reinstating the suspension policy. However, that did not happen. In addition, we know a lot of folks right now are worried about if there's going to be another shutdown. We know this new COVID-19 variant is rapidly impacting impacting, again, the whole entire globe, right when a lot of people had this false sense of security that COVID-19 was coming somewhat manageable and coming, under control. We are now facing with this new variant. Um, Places like Israel have shut their borders. The Biden administration did say that they are actually banning people from at least 8 South African countries to come into the United States as a hopes to manage this spread. Again, the World Health Organization has actually advocated against some of these border closing and cautioning how it's going to impact the supply chain, the people's ability to be reunited with their families, and how we're able to manage some hysteria. Unfortunately, we are seeing that a lot of places are not only closing their borders, but going back somewhat into semi-lockdown situations. So again, it's very imperative that people pay attention to what's going on. Social distance, wash your hands, stay home if you're feeling under the weather, wear a mask when you go outside. And if you are able to do so, make sure you're getting your your vaccinations, taking your vitamins, and just doing everything you can to stay healthy. This new variant is supposed to be more contagious, and some reports are saying that it is actually not going to be mitigated through vaccines. So some of the vaccine efficacy falls to around 40%. So it's very important, again, that as people are rushing to return to normal and to go back outside, that they are practicing safety and precautions so that these new strains and variants do not keep mutating and actually have a moment to rest and to stop. Again, we know a lot of stuff is happening. We've seen just at the legislature a conversation about interruptions into the supply chain. And so we know that COVID-19 is still impacting people. We know that people are still waiting for unemployment benefits and still waiting for housing assistance. And some of those hearings are ongoing with the legislature. Again, last week we talked about House Bill 2046, which is actually working its way over to the Senate right now. That's going to change the way community bail funds are operating. So our legislature is still very active, still passing bills, still negotiating bills. So again, it's going to be very important that people take this time to pay attention to what's going on politically. But before we get to our guests, we also wanted to remind people that it is once again election season in the city. In the county, we do know that because we have this new incoming mayoral administration, that there are going to be some seats coming available leading into a special election once Representative Ed Gainey gets sworn in, followed by possibly Deputy Mayor Jake Wheatley. And so when that happens, there are going to be at least 2 seats open, if not more. But again, to caution people, to remind people, we are still waiting to hear about what the redistricting map is going to look like. That map can be introduced in the next couple of weeks, all the way up until the election in May. So again, please pay attention, figure out what's going on. We know a lot of people are overwhelmed. It's the holiday season, it's snowing, people are cold, and people are ready, for a lot of this stuff to be over. But please still understand there's a lot of things going on. And tomorrow morning, there's going to be an announcement about what's been going on with the judiciary. So please, stay tuned for what is happening. We want everyone to stay mindful. We want everyone to stay involved, and we want everyone to stay empowered and engaged with everything that's going on within the community. So, like I said at the top of the hour, we have a great program for you. Our program tonight, we're going to be talking about World AIDS Day. As so many people know, whether through personal experience or just news or just daily experiences, lived experiences, when AIDS first came onto the scene, a lot of mistakes were made, and a lot of misfortunes occurred that resulted in millions of people being unnecessarily discriminated against and impacted by this illness. But what a lot of folks are not aware is a lot of the research that went into AIDS and HIV is actually one of the reasons why we have the COVID-19 vaccines and the COVID-19 medicines are able to treat and mitigate some of these illnesses because of some of the same research that went into looking at this illness has also been used to study how COVID-19 is moving through as a virus. And so we want to reflect on some of the lessons that we learned. We want to take this time to amplify the people who are doing this work in the community. And for that, we have two different segments. Our first segment is going to be talking with Chaz and Jessica from Project Silk, a local based Pittsburgh organization that primarily works with Black and Brown people of color who've been impacted through various social determinants of health. And they also do focus on services and supporting people living with HIV as well as AIDS. And so we want to welcome to our platform Jessica and Chaz. If they are here with us, hello.
Hi.
Thank you. Hi,
Thank
good
you.
evening.
Thank you all so much for joining us. We know it's been a long day. It's a cold week, and so you're very appreciative of both of you taking some time out to sit with us this evening. But just for introduce to our audience, can you just talk about what you do at Project Silk and give us a little bit of the history of Project Silk?
Sure. Chaz, do you want to go first? Or do you want
No,
me to
you
go
go
first?
first. Yes.
Okay, fine. My name is Jess Burdick. My pronouns are she, hers. I'm the program director at Project Silk. And we are, in a nutshell, a safer space for LGBTQIA plus youth and young adults of color. We service ages 13 to 29. And our primary goal is to decrease the rate at which folks are diagnosed with HIV and STIs. So we do offer free and confidential HIV and STI testing. We also offer a lot of other linkages to things like housing, education, employment. And we have a ton of arts-based, more recreational and healing programs as well. That's us in a nutshell. And I'll let Chaz introduce herself.
My name is Jess. My pronouns are she, her. I'm the medical community support specialist at Project Silk. Jessica is my supervisor and program director. She described very well what we do, and then my specific responsibility is sexual education and wellness and testing, primarily testing and educating folks on HIV and AIDS, the risks, those sort of things, and navigation of healthcare if someone has other needs. Then we do everything we can to link them, whether it be through a healthcare continuum with PEP or PrEP. We work on housing, different things like that. So those are my primary responsibilities.
Perfect, perfect. Thank you so much for that introduction, Jessica and Chaz. But can you just talk a little, since we're looking at World AIDS Day, can you just talk about how still in 2021, AIDS and HIV is still impacting and showing up in our community? And can you just talk about what it looks like for the people that you are currently serving?
Yeah, for sure. I can start, but like Chaz, we can go back and forth. So just like cut me
Okay.
off or jump in whenever. um,
Okay.
so you said the ways in which it's showing up in communities still. Um, well, a lot of folks think that HIV and AIDS is like a thing of the past, but people are still being diagnosed with HIV in 2021. People also aren't really aware, I don't think, of the ways in which people can go about getting treatment. A lot of folks who are not privy to the information really think it still is like the death sentence. I don't like saying that all the time. I know I said that last year as well, but some people still look at it like that, and it's definitely not. There's people out here living well and thriving who are living with HIV. A lot of the community members that we serve are what is called high risk. So we do preventative services by providing like things like free condoms, and as Chaz said, like a lot of different testing and things like that, trying to get folks routinely test so that like you're not just coming every 2 years, or you're not just coming after like a really fun weekend, you're coming like every 3 or 6 months, or something of that nature, depending on how at risk you might be, if that makes sense. But yeah, I could ramble, but I don't want to do that. So I'm going to let Chaz jump in a little bit.
No, you were good. I was all into it. I was like, yes. Yeah. I don't have anything to add to that.
Okay.
Well, Chad's coming to you. You said you help people with support, finding a health plan. Can you just talk about some of the options that are available for people? And even before we get that, can you just talk about what the testing process is like, how you can help refer people to that?
Okay, well, it's really unique. So what I'll talk about is the structure at Project Silk and how our whole staff kind of works together to get like an outcome. So in a nutshell, we have peers who are always out in the community, peer advisors, and those people are Roy and Miguel Bell. And then we also have the artist Rashad Xavier. We have Tierra Brown. There is myself, and of course, our program director, Jess. So the peer advisors are out in the community. They are meeting with folks, young folks, they're educating folks, they're making contacts, they're making people aware of the fact that we have this program. We have free testing, we have links to PrEP, we have links to PEP. And so people oftentimes come in because they've met one of these peers and have made a connection with them that makes them feel comfortable to come down and get tested and be educated on a variety of things, but just to keep it focused on testing. So someone would come into Silk, into the drop-in center, and they would sign in and they would say, check off a list of things that they're interested in either learning what our services are, or they actually need these services. And if they are there to get tested, they'll be called into a confidential office, medical office that is also within the space. And they'll fill out a series of forms that have to do with confidentiality, that have to do with explaining their rights to them, HIPAA. And so we go through these processes with them and explain to them what they're actually doing. And if they take the test, they can get an STD or STI test, syphilis, Hep C, HIV. And what am I missing, Miss Jess?
Chlamydia, gonorrhea.
Yes, that. And so we can take specimens. We take urine specimens. We take finger prick. And we also do mouth swabs for these. And they're primarily rapid tests, except for a 72-hour wait on our STI, our gonorrhea, chlamydia. So essentially, you come into this office, we, are building this rapport. I'm the person who is testing is educating you on these things. You're talking about your risk and why you want to get tested. And we also have other things that are available for folks who come in. So we have tons of condoms. If you need condoms, there's no reason for you not to have condoms. Contact Project Silk. We have non-latex condoms. We got the yummy kind. We got the get right down to business kind.
Glow in the dark.
Yeah, anything you could be doing that you will be like, they don't have a condom for this. We have a condom for that. So it typically takes 25 to 45 minutes to get your test result outside of the 72-hour test for the STI. You can wait inside the office. You can go get a coffee. You can hang out, play music. Before COVID, it was typically a very, very lively environment.
Yep.
People from the community constantly coming in, cooking, eating, talking, voguing, painting. Like it's one of those places, And so you would get your result. If you are positive, we would counsel you about being positive. We would also refer you so you could get another confirmation test. And so we would refer you to another agency that can give you a full test. You can jump in, Miss Jess, if I don't have the terminology.
No,
And then we
you're
would
good.
and then we would
Preliminary,
begin to
positive,
build
and
you.
confirmatory.
Nice, yes. And then we would begin to build your care continuum from there. So, and then the person who tests you can be there with you at every other test. They can help you with a variety of things that are available just through Project Silk CHS and other things like bus tickets to go to,
Mhm.
places and travel with you, so you don't have to go to appointments by yourself if you're nervous about talking to medical professionals. We had a prep telemedicine model, which was amazing because we could actually connect our clients with specialists from the University of Pittsburgh Medical Center and infectious medicine, and they could FaceTime with them in our medical office and
Mhm.
ask questions about PEP or PrEP or whatever the situation was. I feel like I'm long-winded, so
No,
did I answer?
you answered the questions, and I think it's pretty cool. You were saying, there's the community aspect. You're doing art. You have, other people in the space. So there's a communal aspect. Why was it so important for you all to make sure that Project Silk was a community based like organization for people who are coming in, at this very possible, scary moment in their lives to figure out what their next step is going to be, and why was it so important for you to make sure that people had access to the secondary and tertiary medical provider?
Yeah, so I'm going to jump in on this, and then Chaz, please feel free to chime in at any point. But like a little history of Project Silk, I think will help kind of answer that question. So Project Silk was actually implemented in 2013, so almost 10 years ago, which is crazy. And it was implemented under the University of Pittsburgh School of Public Health as a demonstration project. And researchers at Pitt with Pittman's study really communicated via roundtable discussion with community members to try and figure out what the community needed as far as HIV prevention, specifically for Black MSM, so men who have sex with men, and also young Black transgender women, trying to come up with an intervention that would really help provide support for folks in the community here in Pittsburgh. So through these various discussions, they really were able to come up with Project Silk. But a lot of that was honestly led by community members. We actually have a co-founder of Project Silk that we work with, Michael Brookins. And they were really able to, from the top down, say what was needed in the community. So it was known that people were having issues accessing housing. So obviously we needed somebody that would be able to provide some case management when it comes to housing access. Also known that people are struggling finding employment, not because they're not looking, but because there's a lot of barriers to obtaining employment that we can probably talk about later. Somebody to help navigate that system, somebody to help with them with resume building and role playing for interviews, and even clothing for interviews. We know that food access can be a huge issue in Pittsburgh, especially Black and Brown communities. We still have food deserts here, actually, believe it or not. So with that knowledge in hand, it obviously made sense for us to have something like a food pantry, which we do have. And then, of course, first and foremost, I should have started with, we're here primarily for HIV prevention services. So they wanted to make sure, of course, that was offered free and confidential whenever we were open. And really, it was created because there wasn't a place for people of color to go safely. Of course, folks can go to the Department of Health, they can go to different medical providers, but folks just didn't feel safe going to these providers. And that can be because folks felt like they were being overlooked. Folks felt like, not felt like, I should really not use that language. Folks were experiencing things like microaggressions. Folks were experiencing major aggressions like in racism and things of that nature, which are nothing to be taken lightly. So for all these reasons and more, there just wasn't access for a lot of LGBT youth and young adults here in Pittsburgh, specifically Black and Brown individuals. So out of that really came Project Silk. And the community part is very, very important because while we're doing all those services, as Chaz kind of mentioned earlier, And this has changed a little bit since COVID, but the vibe is really like you come in and you're able to build and connect to community. So of course you're getting things like testing, but you're also able to like sit down and have a meal, break bread, listen to music, find things in common, really like build community and find family. I hope that answers your question. I'm also very long-winded.
No, I appreciate it. I really appreciate it. But it kind of goes to my next question, because what are some of the barriers, right? I think sometimes people do not understand if they're not living with an infectious disease, or do not have to worry about not having a primary care physician on speed dial. They may not understand what some of the barriers are to seeking treatment, to getting access to treatment, but also, being a person, a Black or brown person, and trying to talk to medical providers is very, overwhelming for some folks. So can you just talk about some of the barriers and why it's so important that your organization is out here in existence?
Yeah, we certainly can. Chaz, you can start because I just was on like kind of on one, and I'm definitely going to get back on one with this question, but I'll jump in whenever you're ready.
I was really looking forward to hearing you answer this question. I swear I was. I wasn't even going to come off mute. I was like, get him, Jess. I'll jump in. If you know what I mean, you go ahead, and because I just feel like I love it. Go ahead. I'll hop in with examples. We'll bust around split story.
All right. So there's a lot of barriers, right? I recall actually this part of our conversation last year, and the list could have gone on and on. But some of those barriers we actually mentioned, like access to transportation to literally get to set appointment, right? That is something we're able to help with to a certain extent. But folks have to be able to come to the space to get that support. You know what I mean? And also if folks are living a little further out from the city, it just like makes so people have to get on multiple buses to get to one appointment. And somebody that's ignorant might say, well, get up early and go. But it's not that easy when you're thinking about like my job I have to get to. And then if you have children, if you have other obligations, it's very difficult to navigate that system. So just transportation to get to the appointment for the test, or to get to the follow-up appointment for your prep or your PEP, whatever it might be, there can be a lot of barriers there. And then you kind of can jump into finances and things of that nature. So employment can be a huge barrier. I know we have a lot of jobs right now in market, but there's still issues with folks being able to really navigate that system. There is still a lot of discrimination that folks experience when it comes to obtaining gainful employment here in Pittsburgh. There's a ton of discrimination that our trans and non-binary brothers, sisters, and siblings experience on a daily basis when it comes to gaining employment, especially for Black and brown individuals here in Pittsburgh. So that can be a huge barrier. Why? Because in order to live, obviously you need money. You need some sort of support. Like nothing in this world is free. So that can be a huge barrier for folks. I've listed two of my biggest ones. Chaz, do you want to jump in, or do you want me to go down like the racism like pipeline? Because I will definitely tread on down, but you're more than welcome.
I'll add because I think that is a major part of it. Just to add to that, because racism is a major part of it. We are living in a city that institutional racism is still practiced, and we can bring up countless examples. But I think that for the barrier aspect, it's easier to point out that some young people are just very uncomfortable talking to medical professionals and other kind of professionals who may come across as condescending and impatient, if we can just keep it very, and so I think there have been countless times when folks do need an appointment. They do need a follow-up appointment. They need to speak to someone. They need some results from some appointment, and they just are not calling back because they feel intimidated and they need that extra help or support, or they may not know how to speak to a medical professional and feel like they're getting their questions answered, or they may not feel within themselves confident enough to communicate their needs and need some assistance with that. And I think that if they're going into an environment that is already practicing on a daily basis, knowingly or unknowingly, racism, then it just compounds all of the other things that they're dealing with in this particular scenario and then in life, because sometimes people are struggling with depression. It's not just necessarily a positive or negative result for STI, HIV, AIDS, that sort of thing. There's so many complexities that go into the community that we serve, and helping people to just feel safe in the world, and feel heard and seen and supported, and also in a way that people can help themselves after we make a few appointments together. Do you feel comfortable now to call and speak to your doctor and say, hey, and are you comfortable to build a relationship, or do you want me to go to every appointment with you? Because it may take years before someone is comfortable. I may go to 4, 5, or 6 doctor's appointments, pap smear, whatever it is. So I think that is a major, major, major one where people almost can't pick up the phone and speak for themselves, or they just feel intimidated, or they feel shunned in some way.
Thank you so much.
You want to add anything else?
Okay. No, not really. I think you explained that really well. A lot of what you were talking about, Chaz, really was spelling out to me health literacy as a barrier. I don't need to really explain that further, because I think you definitely expanded upon that in your explanation. And obviously, we know you talked about mental health and things of that nature as well. Stress is like a huge factor. It can be a huge barrier. When you look at studies that talk about stress specifically for people of color, they're so disproportionate. So then if you add in marginalized communities within LGBTQIA plus communities, since back to Project Silk serves, that's who I'm thinking of here, it just skyrockets. And housing is kind of the last thing I want to add with that. We all know that like a lot of these systems are pretty much impossible to navigate if you don't have a place to go and lay your head safely. Like Silk strives to be a safer space for LGBTQIA plus individuals. We know we can't be the perfect 100% safe space for everybody, so we say safer space. But if somebody doesn't even have a place to lay their head at night and call their own, that can be a huge barrier. And we know that's a huge barrier in Allegheny County. We know it is. And it can be really frustrating for us as providers. But that's a privilege for me to say that, right? Because I'm sitting in my kitchen right now, right? And provider. So I have a full-time job, right? So these are privileges that like I'm acknowledging that I'm having, and I'm saying it's frustrating for me. But just like imagining and empathizing with the fact that folks literally just don't have this essential item, which is housing, and that can just be a huge barrier for folks. So I just wanted to add that in.
Perfect. I thank you so much for bringing that and talking about all the work that you're doing at Project Silk. As we wrap with both of you, can you just talk about how we get in contact with you? If somebody's watching and needs services, how can they reach out to Project Silk?
I was so fast. Oh my gosh. Definitely can. So you can get us on Facebook, just at Project Silk Pittsburgh. We're also on Instagram at Project Silk 412. We're also on TikTok, Project Silk 412. We don't have any videos on TikTok yet, but they're coming soon. And we're also on our website that is the organization that we're a part of, which is Community Human Services. So that's www.chscorp.org. You can definitely get at me via email, jburdick@chscorp.org. And I'll let Chaz give her email. I don't need to give it for her. Okay, ccheatham@chscorp.org.
She knew I was going to say no. Miss Cass _ Project Silk on IG.
Oh, yeah.
What is the fee for your services? I think it's very important because we didn't mention it. We didn't tell people.
0, 0, and 0. Everything is free, free, free. And y'all, we have so many other services as well. We have a lot of arts-based, kind of celebratory, very meaningful programming at Project Silk as well. So please visit those websites, or just connect to Chaz or myself or one of our other teammates about that, because we have a lot of stuff going on geared towards HIV prevention, but in a very creative way, if you will.
It's a very creative and positive and affirming way. So I hope if anybody's listening, especially if you work with young people, they have a lot of great youth-based programming. So please reach out to Jessica or Chaz. And thank you both so much for joining us.
Thank you.
Thank you. I hope we can come again. Have a good night.
Of course. Thank you. And so as we continue on, again, like we said at the very top of the hour, a lot of what we've done in the past few weeks, even the past few months, with this COVID-19 has been really on the backs of a lot of the early advocates and organizers who really had no other option but to mobilize around the early HIV/AIDS crisis and work together and create organizations and programming really to show up for a community that really was forgotten and left behind and ignored. And one of those organizations was Allies for Wellbeing. Of course, you may have known it as something else, but Allies is the organization that's also situated right here in Pittsburgh that provides a lot of services to the community, and even things you may not even realize. To talk about, what this World AIDS Day really means for here in 2021, and talk about some really great programming. We want to welcome Mary Beth from Allies onto our program now, so we can just talk just a little bit more about some of the things that are happening within the region, and to learn more. So welcome, Mary Beth.
Thank you, Miracle. I'm so excited to be here and to be talking with you and your audience today. And it was great to hear from the folks at Project Silk too.
Yeah, I know. It's always great that there are so many community providers and people who are really just impacted doing the work. And so can you just talk to us a little bit about what Allies does and some of the history of Allies?
Of course. Allies actually started out as the Pittsburgh AIDS Task Force, and we were founded in 1985. We were part of the Pitt Men study, and we started out as a volunteer organization because a lot of people who were being diagnosed with HIV and AIDS in the early to mid 80s, there just weren't resources available for them. There was so much discrimination at the time. One of the first services that we began offering was legal services, so that someone living with HIV who was possibly being discriminated against at their job or in their housing situation, our legal aid services would connect them with a lawyer who would help them through that situation. Another one of our early programs was the Buddy program. Unfortunately, in the early days of HIV and AIDS, there was a lot that we didn't know about the disease, and there was a lot of misinformation. And, people were afraid to come into contact with someone who had HIV or AIDS. They didn't know, if shaking hands, if they could get the disease, which is not the case. So the buddies were people who supported people living with HIV, people with AIDS. At that time, a lot of it was helping them die with dignity, having someone to, help them get to doctor's appointments, and just having someone to be there for them. So that was the work that we started out doing. Fortunately, when the antiretroviral medications came out in the mid 90s, we saw people who were living with HIV and AIDS instead of people dying from HIV and AIDS. So our scope of services shifted. We had to help people, navigate their lives living with HIV, getting the proper medications, getting to doctor's appointments, and just, what they needed, giving them the support to live a long and fruitful life with HIV.
Perfect. Thank you so much. And so, can you talk about some of the services that Allies provides to the community now?
Absolutely. We offer free HIV, hepatitis C, and syphilis, gonorrhea, and chlamydia testing. Those are at our offices in East Liberty. And we also have a mobile testing van that goes out to different places in the community. We offer a full medical clinic. One of the things that we found when we were looking to kind of expand our services was that people didn't want to go to the HIV clinic. They didn't want to go to the AIDS doctor. They just wanted to see their doctor. And you can do that at Allies. You can come to Allies and get your primary care, your gynecological care, uh, anything that you would go to the doctor for. We can deal with that at Allies. For people who are living with HIV, we have case management. We have a food pantry and a housing program. We offer transportation assistance. And we also have 2 mental health counselors on staff who work with our clients who are living with HIV.
Perfect. And I know, I think Michael would be very upset when they talk about the kitchen a little bit more. Because you just talk a little about what the pantry kitchen does and how people can sign up for the service.
Of course. As of right now, our food pantry is available for our case managed clients, and our case managed clients are people who are living with HIV. You did not have to be diagnosed by us at Allies to take advantage of our case management services. You can just give us a call and let us know that you're interested in case management, and we can get you into the program. The food pantry is one of the things that, due to COVID, it's pretty much going to be the last program that we offer that goes back to quote unquote normal. As of right now, we're offering very limited access to the food pantry itself, but we are providing gift cards to our clients so that they can go shopping and get the groceries that they need. Our case managers also can stop into our pantry, load up some bags for our clients, and drop them off at their houses as well. So yeah, the food pantry is a big part of what we do. And we're very happy that that's something we're able to offer our clients.
Yeah, and you also talked about having a full service clinic. Allies also recently announced that they were providing and supporting people with gender affirming care. Can you just talk a
Mhm.
little bit about that for our viewers?
Yes. Our physician assistant, Braden Bash, has gotten training in gender affirming care. And that is something that we can offer at our clinic if you're interested in getting on hormones. We have estrogen and testosterone. So, whatever you're looking for, we have those hormones, that hormone therapy available. We also offer referrals to services that we don't provide in the office. For example, like plastic surgery, if you're looking to have top surgery or something like that. We can also do referrals for like voice training and mental health services as well.
Perfect. And I thank you so much for that. And as also as part of being a full service clinic, can you just talk about some of the medical medication and prescriptions that are provided to people living with HIV or people who are actually in the stages of having AIDS? Because sometimes people may say, oh, it's the HIV clinic, so I can only get a certain type of medication, or I may not get the medication that I heard about. So can you just talk about the prescription programs that you offer so that people are able to make an informed decision before they come in?
Absolutely. Well, first of all, if you come to Allies to get tested and you do have a reactive test that says that you are HIV positive, we put into effect the rapid protocol. We can walk you across the hall from our testing facility to our clinic so that you meet with someone that day to talk to you about, what does it look like to be living with HIV today. And we can start you on antiretroviral medication immediately. That's something that we're very proud of. And that's something that, I think we were one of the early adopters of that in the Pittsburgh community. We also work with CCN Pharmacy, and you can get your prescriptions through us. And I believe we have the mail order option. So if you get your prescriptions through Allies, they can be mailed directly to your home. We do treat everything that we test for. So in addition to HIV, we have the medication to cure hepatitis C. Hepatitis C can cause a lot of damage and can go unnoticed and undetectable for a long time. But it is extremely treatable, and we have the ability to do that at Allies. And then we also treat for syphilis, chlamydia, gonorrhea as well. And as I said before, we are a full service health clinic. So anything that you're going to go to the doctor for, if you've got a sinus infection, if you have allergies, like I said, the gynecological care, if you're looking for family planning, birth control, that is something that we offer in the Allies Clinic. And as I said, we work with CCN Pharmacy to do those mail order prescriptions.
That is like simply amazing. I really appreciate you for coming on and talking about that. And before we go, I know it's like super late. Can you just talk? You said you have an event coming up. Can you just, because it is World AIDS Day, can you just talk about how Allies has been involved in World Day locally, and what this new event that's coming on is?
Of course. World AIDS Day, I think, is especially important this year because the year 2021 is the 40th anniversary of the AIDS epidemic. It was in late June, early July of 1981 when the CDC first published reports about strange illnesses that were cropping up, and that was the forerunner of what became the AIDS epidemic. So we are marking 40 years that we have been in a world that has AIDS. And we're continually working to get to a point where, we live in a world without AIDS. So the event that we are having is on Wednesday, and it is going to be at the Giant Eagle in, I'm not sure if it's East Liberty or Shady Side. It's on that border there. But it's at the corner of Shady Avenue and Penn Avenue. And we are going to be having our some guest speakers. We are going to be having health fair. We have multiple community organizations that we work with who are going to be tabling at the event and passing out information about their services and the things that they do. And we're also going to have our mobile testing unit there, so you can get tested for HIV right on site. And since we do the rapid test, results are in about 20 minutes. So we're very excited that we're able to have this event, and we're very grateful. We have a long list of community partners who have worked with us on putting this event together, and we're really excited to see it come to fruition.
Yeah, and I think it's always a great reminder that it's a lot of organizations that are coming together and working together, because a lot of the discrimination that people, in the early ages really laid the groundwork and the foundation for like medical collaboration. And a lot of the barriers that people, are facing are still there. And so that's why it's also important people understand, the Allies is led by people who've been impacted by HIV and AIDS. And for full disclosure, I do actually sit on the board of Allies, so I don't want people to be like, "Oh my gosh, I've been lied to." But like, no, I think it's like very important that people with like lived experiences, people who've been impacted by illnesses and and medical discrimination, are actually leading these conversations. And Allies is one of these organizations. You said it's located right in East Liberty. A lot of the services are free or reduced cost. So we want to encourage people to go in. And before we let you go, can you just talk to people how they can get in contact with Allies, and how they can maybe set up appointments?
Absolutely. We recently launched a new website, which allows people to make appointments right on our site. And that website is allieспgh.org. And then we are also on Facebook, Instagram, and Twitter. And you can find us at allieспgh on all of those platforms.
Perfect. Well, Mary Beth, thank you so much for taking the time to join us this evening. I hope you have a great rest of your evening and you're staying warm, and hopefully the snow won't get too much in your way.
Thank you so much for having me, Miracle.
All right, you're welcome.
Bye.
Bye. And so again, that was Mary Beth from Allies for Health and Wellbeing, another local organization right here in Pittsburgh that's doing the work. Again, as this Wednesday approaches, the commemoration of World AIDS Day, we want to remind people that even though COVID-19 is still going on, a lot of these other, illnesses and infections are still in existence. So we want people to stay, informed and educated and know the resources and tools that are available for them so they can take advantage of them and have the most optimal health. What we want people to remember is that, you can live full, healthy, long lasting lives with HIV diagnosis. There's so much that has advanced in the world of medicine. And so it's very important that people know that and are not afraid but empowered to go to these medical providers, to take these tests, to know their status, and so that's how we had this program, and we'll continue to have this program every year. With that, we want to thank, Jess, Chaz, and Mary Beth for taking a little bit of time to sit with us this evening. And as we close out, we have a couple of announcements. So a lot of stuff, like we said, that's going on in the region. There's a lot of change that's happening, and we're very excited that you have taken the time out to watch and engage our program, to talk with our elected officials. And we have a lot of programming coming up for you in the new year. So first things first, we are going to be launching our second season of Sunday Night Sit Down in a couple of weeks. So if you are a candidate and you're running for office, please get in contact with us. We will also be getting in contact with you based on the information that you gave the Board of Elections. If that information has changed, if you've now have a campaign email or a campaign website, please make sure you're getting in contact with us because we're going to have that series coming on. If you liked our scorecards, if you loved learning about these politicians through our candidate forums, guess what? Those are also coming back next year. We'll have a series of forums. The first ones will deal with the special elections. Then the rest of the forums later on in the latter part of the spring are going to deal with the primaries elections going forward. So we'll have 2 series of forums. Depending on what's happening with COVID-19, they'll be virtual or in person or a hybrid of both. So please just stay tuned for those. But as you know, tomorrow is Tuesday. It is Giving Tuesday. And so we are asking as well for your support. We have a PayPal, we have an ActBlue. And so tomorrow we hope that you join us in supporting all of the work that we do for Giving Tuesday for our 501c3 and our 501c4 components for the One Hood Media Network. We're asking for all of your support. As you go through, you can just go online to our website, which is, onehoodpower.org, and you can make a donation that way. In addition, since we are talking about health, the closing of tonight, we're going to have a PSA about how to use naloxone and Narcan, because we know that for a lot of folks, this has been a very tough time. And because of a variety of reasons, people are looking to self medicate, people are experimenting, and we want people to, again, use the tools and resources that are afforded to them to be as safe as possible. We'll be playing these PSAs on a lot of our program, and in no way are we trying to infer that people who are living with HIV and AIDS are drug addicts or drug users, but we just launched this PSA campaign and we're playing for a lot of our programs starting this week. There'll be different drops that you will see. So that's what we're going to do at the wrap up. But before we go, as you know, the One Media Network is always out with some type of programming. And tomorrow we have a really great program to what Black Pittsburgh needs to know about education and punishment. And we'll have the great Dr. Kathy Elliott from Gwen's Girls joining us on the program for tomorrow at 2 p.m. So please make sure you are tuned in. There's a lot that's happening on the school board with the suspensions, the changing of superintendents. So there's a lot of things that are going on that we want you to be mindful of as we go into this coming year. And we have a whole new school board pretty much being sworn in different parts of the counties and and the cities and the boroughs. So I want people to really understand what's going on with the local school board policies. Wednesdays, Wednesdays, it gets a little real for this week of white supremacy. So please join us Wednesday at 6 for that. And Thursday, of course, we have On Tilt at 12 p.m. talking about your mental health. But we know a lot of you have questions about this new COVID variant. So next week, not this week, but next week, we'll have Ask a Black Doctor back so we can talk about COVID-19 and what that means for you and your community. Again, remind people the flu is also here, so take your flu shots. If you can, go ahead and make sure you're washing your hands, wearing your mask, and being as safe as possible. There are a lot of events happening. And last thing before we go to our PSA, to remind people, the family of Jim Rogers is still out advocating and demanding justice and demanding answers for what happened. The surveillance that was supposed to be released has not yet been released. A lot of information has not yet been made public. And so a lot of people are still trying to figure out what happened to Jim Rogers. Why was he tased? Why was he transferred to the jail and not the medical hospital? Why was he not giving medical aid? And so there's going to be a protest tomorrow at Frankstown, I believe, starting at 6 p.m. And so please make sure during this time you keep the family of Jim Rogers in your prayer. In addition, we know there's been a lot of accidental shootings over the past couple of weeks, and for someone to say an increase in gun violence. Depending on how you fall on this issue, the city of Pittsburgh police did say that they're launching a campaign to give out locks for people who have guns. So if you go to the city of Pittsburgh page or the Pittsburgh police page, they'll have information about that. I am not aware if there's any type of tracking or reporting that goes along with that. But if you are someone who has a gun and you're looking to have a lock, you can reach out to them or other organizations. With that, we hope you all stay warm, stay safe. If you are looking for housing support, we did post some flyers about housing support, and we'll post them again. But we want you to stay safe, stay warm, and stay healthy this winter. And we're going to play a PSA. And thank you so much for joining us this evening. I hope you have a great day. Okay, we're having small technical difficulties. With that, no worries. Like I said, we're always here. Things happen at the last moment, but we want to make sure again that people are healthy and understand what's going on within the community. Again, recently in the city of Pittsburgh, fentanyl test strips have been decriminalized. And so we want people to understand that that is a tool and a resource for them. In addition, Narcan, also known as naloxone, is readily available, and that can actually counteract a drug overdose. And so I think it's very important that you are made aware of this information. And so we're going to play a PSA uh, for you in this regards, because we want to make sure you are aware of some of the tools and resources that are available to you.
I'm Alice Bell. I want to make sure that everybody knows how to use Narcan or naloxone. They're the same thing. Narcan is the brand of the nasal spray. Naloxone is the generic name. It comes in a nasal and an injectable, and you should know how to use both, because if you're with somebody that overdoses on heroin or fentanyl or other kind of opioids, you never know which kind might be there. Prevention Point gives out injectable naloxone, comes in a black bag so that because it lasts longer if it's not exposed to light. Inside the bag are 2 single-dose vials of naloxone and 2 intramuscular syringes and an instruction card. The way that you use it, you see somebody who you think might be in an overdose, you shake them, you call their name. If they don't respond to that, you want to see if they respond to pain. You don't have to smack them around. You don't want to hurt them. Take your knuckle, rub it hard on their chest, pinch a fingertip or an earlobe. Those things are painful. If they don't respond to that, then they may be in an overdose. Check and see if they're breathing. Put your ear close to their mouth and nose. Do you hear any breathing noises? Do you feel their breath on your ear? Do you see their chest rising and falling? If they're not breathing, it's important to breathe for them. The reason that people die of an opioid overdose is they stop breathing. Breathing for somebody can keep them alive until help comes if you don't have naloxone. If you do have naloxone, giving them a few breaths, keeping some oxygen in their lungs while you give them the naloxone can also save their life. The way that you breathe for somebody, you lay them flat on the floor on their back, tilt their head back, open their mouth. First, check inside their mouth to make sure that there's nothing that's blocking their breathing. Gum, puke, food, anything that you could scoop out with your pinky you want to remove. Then take a deep breath. Pinch the person's nose with your fingers. Make a seal with your mouth over theirs. Blow in 2 breaths to start. Blow up their lungs like you're blowing up a balloon. Then give them 1 breath every 5 seconds. So count 1001, 1002, 1003, 1004. Breathe. You can keep somebody alive just by breathing for them. To give them naloxone, the injectable naloxone, you're going to pop off the orange cap, open the package of the syringe, take the top off the syringe, pierce the rubber stopper, and pull up all the liquid that's in the bottle. The bottle's not full. The amount of liquid that is in the bottle is 1 dose. So you're going to take that, and then you're going to inject it into a muscle in their thigh or shoulder. It's a big needle, so you can go right through their clothes. Just jab it into the muscle, press down on the plunger, and then wait for it to work. It can take 3 to 5 minutes to work. So you want to keep breathing for them while you're waiting for it to work. If they don't start breathing on their own after about 3 minutes, give them a second dose. The nasal naloxone is a little bit easier to use for people who aren't used to injecting. Comes in a box like this. There's also 2 doses in the box. Inside, 2 blister packs. You just pull open the pack, take out the unit, stick it in the person's nose, and push on the button. You won't see the spray and you won't hear it. But once you push the button, all the spray goes into the nostril. Again, keep breathing for the person while you're waiting for it to work. It's absorbed through the nasal passage, so even though they're not breathing, it still will absorb. If they don't start breathing on their own after 3 minutes, you can give them a second dose. You can get naloxone from Prevention Point. You can get naloxone from the Allegheny County Health Department. You can buy naloxone at a pharmacy or have it paid for through your insurance. There are lots of other places to get naloxone. You can find more information on Prevention Point's website. That's pppgh.org. You can find out all of our sites, where to get naloxone around the city, and more information. There's also a video there that shows you how to use naloxone and other information.